Welcome. I am Vanessa Loizu, and today we're going to be talking about AMIKO pill, CMCA pill. So within the AMIKO pill, we actually receive 5 vials with 10 millilitres in each. So for each clinic, one box is going to give you 25 treatments for your clients. The peel is very much a no pain, no peeling and no downtime. It's such a glossy peel with so many benefits. It's not photosensitizing, so it can be used all year round. Basically, all Fitzpatrick, even the most darkest of skins, this peel is suitable. It's fast and easy application, stable in a room temperature, appropriate for all seasons, and can be combined with many aesthetic treatments, including microneedling and mesotherapy. Contraindications, so up there obviously would be cancer, pregnancy, breastfeeding, use of steroids. Topical steroids, we say 3 days prior to carrying out AMIKO pill. And with any antibiotics, we're looking for a good 2 weeks to have stopped so the antibiotics is out of the system. Also, a big one is if your client is vegan, very important question, or if they have any milk protein allergies, they will have more of a red reaction and have some more downtime. Active ingredients. Now, this is amazing. It's got a whopping 33% colostrum. Why colostrum is so amazing is because it is renowned for its inflammation reducing. So any skin concern is inflammation. So if we've got acne, rosacea, even the sensitive of skin of eczema, psoriasis, it's a very safe pill. Acne, pigmentation, again, colostrum is going to reduce that inflammation within the skin. Lactic acid, it's got a 20%, which is very hydrating for the skin. So you're really strengthening the skin barrier. We have glycerin, it's got many amino different acids, salicylic acid, allantoin, proline, oxalic acid as well, which is very amazing for rosacea skin concerns, post-acne scarring, things like this is going to help. But why colostrum? Colostrum is rich in complete probiotics, antioxidants, anti-inflammatory. So compounds, it's very regenerative peptides that can help reverse the signs of aging skin and modulate elastin expression. So it's got 100 most important nutrients for your skin cells to survive. Colostrum bioactive can improve skin elasticity and hydration, and enhance the collagen production for that plumper skin that we all want. Colostrum is the only ingredient which allows and well-proven influence on the reduction of the rate of the telomere shortening. And colostrum increases the proliferation rate of the fibroblast, and we all know where that is the magic happening. So antioxidant cell protection, vitamins, fatty acids, cell food, and amino acids, which is the building blocks for the skin. So colostrum, again, all of the compounds found, we have the growth factors, we have the fats, the lipids, the minerals, vitamins, protein, carbohydrates. So expanding on antioxidants within AMIKO pill. An antioxidant isn't a type of ingredient, but it's the functional action a specific ingredient has on the skin. So free radical damage is what antioxidants are taking care of, either by stopping new damage or by reversing earlier damage caused by the free radicals. So antioxidant basically supports the anti-inflammation, reduction of wrinkles, the scars treatment, repair of damage. So we know cell food amino acids, only 10 amino acids can be produced by the human body. AMIKO pill has over 29 different amino acids, and you can see them listed here. So growth factors, let's dive in a little bit deeper with the growth factors. The palate-derived growth factor stimulates fibroblast proliferation and enhances wound closure. TGF-alpha, produced by the fibroblasts and keratocytes, enhances cellular proliferation and differentiation. So VEGF, vascular growth factors, supports the creation of the new vessels and capillaries, which is vital in the anti-aging and scars treatment therapies. Glycerin is a very hydrating for the outer layer of the skin, accelerating wound healing process. It improves the skin function barrier, providing skin barrier and relieving the dry skin. So again, when we're looking at the concerns of rosacea or dermatitis or eczema, glycerin is a very important ingredient in the AMIKO pill. We're looking at salicylic acid, is a wonderful ingredient for the oily, acne-prone skins, as it helps to dissolve the oil and dead cells that clog the pores and the breakouts in the first instance. So not only does it provide skin smoothing effects for the skin, it reduces the skin blemishes, reduces the bumpiness, so we get that really smooth texture throughout the skin. It dries out the oily skin, but also helps to fade the dark spots after the post-acne has been clearing. Allantoin helps to heal the wounds, injuries, and scars faster. Topical application drastically improves the skin texture and appearance of fine lines and wrinkles, promotes the skin exfoliation, keeps the skin moisturized, and really helps managing the skin concern of eczema. Panthenol is a really deep moisture retention in the skin. It prevents transepidermal water loss. It soothes and softens the skin as well, improving the skin texture, helps to reduce the redness, irritation, and inflammation within the skin. Also helps to improve the skin barrier's function. Azelaic acid is an effective acne treatment due to its anti-keratinizing, anti-inflammatory, and antibacterial properties. As a keratolytic, it works to soften and break down the layers of the dead skin cell buildup and debris that causes the blackheads and the pimples. So it's killing acne, which is the causing of bacteria, protects the skin from free radicals, prevents pore clogging, prevents dark patches, and helps to reduce the redness, irritation, and inflammation within the skin. Amino acids, like collagen peptides, promote skin smoothness through their amino acid composition. All proteins are made up of building blocks. These are called the amino acids, the STAR treatment. So each protein has a special combination of amino acids. These three amino acids, the proline, glycerin, and lysine, are flexibility boosting benefits of the collagen. Okay, moving on to the protocol of use. We recommend 4 to 6 sessions spaced every 7 to 14 days, depending on your client's concern. We would start the process by cleanse and degreasing of the skin. So we have your auric hydrating mousse to cleanse the skin. We can use alcohol wipe or some detergent to remove and make sure that the grease, or also what we just have released is AMIKO enzyme pre-peeling. So we can use this before we commence the AMIKO pill. So if we're treating just the face area, we're looking to use a whole 2 milliliters. If you think a palm size is 1 milliliter, 1 milliliter, it's 2. For the face, of course, you'd use slightly more products if you're going down onto the neck. We apply the 2 milliliters of AMIKO on the face. We're waiting now for the 3 to 5 minutes. You're checking in with your client. You're going to let them know that they're going to feel maybe a little bit of spice, a little bit of warmth throughout the skin. This is completely normal sensation. We're checking the whole time to make sure that the skin is looking exactly how it should. You may get a little bit of redness, but again, reassure your client that this is completely normal. Once the time has gone, we're going to start to neutralize. Now, you can just use water, but there is certain acids and active ingredients within the AMIKO pill, but just using water is not going to be enough. It's not suffice. If we know we're going to use something that is going to neutralize the pill and stop it from working, you're then assuring your client and yourself that there will be no further contraindications. We apply either with your hands, with a brush, and making sure you leave just for 1 minute, and then it's neutralized, and then you can remove with water. Final steps, we're going to be applying our auric serum, full of antioxidants, our colostrum day cream, of course, and then mandatory SPF 50, all from the auric range. So to share some of my AMIKO CMCA procedures that I've carried out in clinic myself, so real life results with real clients, this one in particular, I just feel was amazing because rosacea, you can see, is very present within the skin here. This is just after 2 AMIKO treatments. We also combined, I would say, there was exosome rose exosomes therapy. So we done mesotherapy as well as AMIKO peel. And just look at the results. The redness, the skin tone, the texture has really, really improved. The exosomes that we used within this rosacea client here was from the AMIKO Rose exosome. It's a new product that is coming to market next month. Again, just exploring some real clients, real skin that I've treated in clinic myself. And this again was fascinating because only after 2 treatments, you can see a significant reduction. Not only with her rosacea, you can see just how glossy the skin is, but also you can see the fine lines, the scars, and also you're going to see that reduction with the pigmentation as well. Same lady, but you can see the inflammation reduced even more, and just how even that skin tone is. Again, just carrying out 2 AMIKO peel treatments in clinic. Again, slightly different. So we're just trying to give you a vision, if you like, of all the different skin types that it is suitable for. And I always say, if you've got your skin texture and tone, pore size, we've all got this. So AMIKO peel for me is just fascinating because it ticks every single box. Every skin concern can be treated with this. Dermatitis, eczema, rosacea, if you've got post-acne scarring, if you've got acne, if you've got pigmentation, this peel, tick, 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 it delivers to each and every skin concern. So again, just to reinforce, it's suitable for all Fitzpatrick all year round, and it's a very healing peeling. This particular client, as you can see, the scar treatments, we use a single needle. This is a different kind of protocol, but you would apply 1 milliliter of AMIKO peel. We then use the microneedle just to kind of tease the skin and open up the channels in order for the peel to then penetrate deeper into the skin to produce more of advanced treatment. Then you apply the other milliliter, and then you work a little, you leave for 5 minutes, you leave for 3 to 5 minutes, again, dependent on your client. And then you can follow with some more microneedling, probably incorporating the exosomes rose from the AMIKO peel as well to really push and deliver those results to the skin. Acne treatment, you can see it's significantly reduced here, but not actually just dealing with the acne. It's actually left no marks on this lady's skin at all. So it's very much calmed the inflammation and healed the skin at the same time as clearing her acne. Again, here you can see just the tone, the texture of the skin has significantly reduced. The pore size for me as well has really, really smoothed out her skin. So then once you've delivered your in-clinic treatments to your patients, how do they then go on and maintain those amazing effects? And I always say that 80% is what our clients do all day, every day. And the 20% is what we're pushing their results further in clinic. So in order to them maintaining their amazing glow from AMIKO peel, they would incorporate their home care. With the home care, if someone wanted to come and get, the gold line, I always say, of home care, you would start with your hydrating mousse. You don't want anything that's going to strip the barrier. You want comfort. Think comfort for the skin. It's very gentle, but very hydrating. So the auric mousse delivers exactly that. Then you'd be moving on to your antioxidant Auric Serum. Now, why I love this product so much is that it's not only protecting with your stable vitamin C, full of antioxidants, it's got no chemicals, so it's brightening, it's healing. We're going to take a closer look at some of those ingredients a little bit later on. After we apply our antioxidant repair serum, we're going to be looking at the Auric Day Cream. Again, one of my favourites. Why? Because it contains colostrum. So changes in the density of the dermal layer. And you can see in these images here, before using colostrum containing cream and how that dermal layer presents itself. And then just 7 days after using the colostrum containing cream. And the results are just so visible. You know, it's science. You can't play with that. Of course, with all in-clinic treatments, it's always advisable. Non-negotiable is a SPF. I always advise from the Auric range, full of peptides, full of your protection. But for me, I always say to clients, it's more than just an SPF. It is a treatment as well as protection. So we would also recommend and advise to use an SPF after any in-clinic treatment. Again, another amazing superstar product is the Auric Night Cream. Again, containing colostrum. Absolutely amazing ingredients, actually. Cetonic acid, just to name a few. Hydrolyzed collagen. Copper peptide. It's got a small percentage of retinol in, as well as vitamin E. So it's a safe retinol that you can use immediately after any in-clinic treatments. A lot of retinols, you have to be careful. You have to stop 7 to 10 days prior to treatment. With the Auric Night Cream, you don't have to do this. So yes, the Auric Night Cream will restore and protect your skin while keeping it nourished. Thank you so much for listening to today's webinar. We are now going to focus on the practical side of AMIKO Peel. I hope you've enjoyed. Thank you.
So we are going to perform a microneedling treatment for the scars treatment today using a one-need device and a single needle. Using single needle is very important because we want to work inside the scar only, not to cause collagen proliferation outside of the scar, as we want to achieve the best and long-term results. After the microneedling procedure, we're going to perform an AMIKO peel, CMCA peel procedure. Why AMIKO? Because of the colostrum, because of the monochloroacetic acid, and those two components are focusing on angiogenesis, on proliferation of the new vessels, new capillaries. When you think about the scar, it's if you would look at it under thermoactive camera, it's sort of green-blue color because there's very little vessels, very little capillaries. So we're using all the components, physical injury and components in the AMIKO peel to induce angiogenesis. Of course, we're going to start with the cleansing of the skin, preparation of the skin. I'm using Auric mousse. 2 or 3 pump is absolutely enough. You can use it dry or you can use it with water. It's a very gentle product. Our model is not wearing any makeup today, which makes it easier for us. We're just cleansing the skin. Removing it with water. The mousse is very effective in cleansing the skin and removing the makeup as well. So it could be used dry or clean. Dry or wet, sorry. So I'm just drying it. I'm not using numbing cream when performing microneedling. Why is that? First of all, microneedling induces inflammation. If I would be using numbing cream, the inflammation would be delayed, and I could get 2 forms of complication. First one, it would be delayed inflammation, which could lead to pigmentation, or I could not get inflammatory reaction as needed. So I'm not using numbing cream. The treatment is not pleasant, but it's not painful to the stage that the patient, client wouldn't be able to stand it. So I'm going to be using a Campomat's device today with the single needle cartridge. And as I mentioned, single needle cartridge is very important because I can work precisely just inside the scar. So 2.5 millimeter. This is no flowback system, which prevents contamination. And I'm going to be working just inside the scar. So a little prickle. It takes time, but it's the most effective treatment for the scars. Are you okay? So scar by scar. I am not treating all the scars in the same time. I would say roughly 50% of the scars in the same session. I don't want to cause prolonged inflammation or big inflammation in the skin. Once again, alcohol wipe. Always using alcohol wipe for disinfection of the area. Almost done, one side. This is the most effective device if it comes to scars treatment. It's not only the prickling of the scar, but the vibration caused by the pen and the needle are causing subcision of the scar. So that's one side done. We take alcohol wipe. Another one.
Almost done.
Okay, 2 more. It's better to take a little bit longer and, in my opinion, to treat scars for a longer period of time. There's quite a few scars on the face area here. And when you are consulting with your patient, when you're consulting with your client, they need to understand, first of all, that it's not a quick fix process. Collagen proliferation in the scars takes time. We are going to perform this treatment every 2 to 3 weeks. The more scars, the more subcision you're making, the more intense microneedling is, the longer the period between the sessions. So if I was to treat all the scars in the same time, the whole area, I would perform the treatment every 3 weeks. How many sessions? I would start with 6 sessions, 6 to 12 sessions. So I would probably think it's at least 1 year therapy. Okay, I did subcision of the scars. Now I'm going to change the cartridge. I'm going to change cartridge to micro prickling. And as I said, I do not want to cause skin injury, serious skin injury outside of the scar. If you imagine collagen proliferation, if I was to work on the same depth in the scar and outside of the scar, microneedling is nothing else as the collagen proliferation. So I would cause thickening of the scar lifting of the scar, but also thickening of the skin outside of the scar. So I would have very little or short-term effect. So outside of the scar, I'm using micro prickling cartridge and just gently working on the skin. This is 0.25, so I just need to cause erythema, which is going to lead to cell communication and healing of the skin. But as you see outside of the scar, the skin, there's no bleeding, there's just a little bit of erythema. Micro prickling is not painful. It's more like a gentle scratching of the skin. And this is dry needling. I'm not using any glide. But as you can see, there is really nice erythema straight away. So I'm just going to do one pass. You okay? What? Spread the skin and just glide. So you can see even erythema on the whole area of the face. One pass is going to be absolutely enough. So now I'm going to take AMIKO peel, 2 milliliters per treatment per face area. The best needle to take out AMIKO peel is 18G needle. This is the peel which you can use all year round. It's phenomenal for a sensitive skin treatment, but also because of the colostrum, because of the chloroacetic acid, it's very good for the scars treatment, as it's going to induce and help with angiogenesis, so the creation of the new vessels, new capillaries, which is vital in the process of skin restoration.
Yeah.
So I'm applying, you don't need to massage it in, you can use the fan, you can use the brush, you can use the brush, you can use gloves, you can just drop it with a syringe, like little dots, however you wish. So I'm applying 2 milliliters on the whole face area. It might be a little bit spicy. It's nothing major, but especially after we performed microneedling, the client can feel a little bit of spiciness on the skin. It usually doesn't last long. Apart from chloroacetic acid and colostrum, the peel contains azelaic acid, salicylic acid, amino acids. Well, colostrum itself contains over 100 ingredients such as growth factors, which are also very important if it comes to the skin restoration in the scars treatment. But not only, lots of anti-inflammatory ingredients. With the scars treatment, you need to remember that we don't want prolonged inflammation, as it may lead to pigmentation, and we want to avoid that. But colostrum contains ingredients which will prevent prolonged inflammation. So we're leaving it on the skin 3 to 5 minutes. If this is the first treatment, I always recommend 3 minutes, and then you can prolong the treatment to 5 minutes depending on your client's skin needs. So after 3 minutes, we are going to neutralize the peel. Why do I use neutralizer? Neutralizer is a substance which is raising the pH of the skin. So the pH of AMIKO peel is 1.5, but there's also components such as azelaic acid, salicylic acid, chloroacetic acid, monochloroacetic acid, trichloroacetic acid. Of course, these are self-neutralizing components, self-neutralizing chemical peels, but AHAs and BHAs peels are not self-neutralizing. So because of the nature of those substances, I prefer to apply neutralizer. AMIKO neutralizer is in form of the gel. When you apply neutralizer, your client, your patient might feel a little bit more tingling. Why is that? because the pH of the skin is changing very quickly, is rising drastically. So the burning sensation may, not strong burning sensation, more the spiciness sensation might occur on the skin. It doesn't last long, but then it gives you absolute certainty that all the substances stop working. All the substances stop working and your client is ready for the next step. So I apply the gel, I leave it on the skin for literally a minute. And after a minute, I remove it with water. As you can see, the skin is still a little bit red. How long is this redness going to stay on the skin? Is it going to be apparent on the skin? Not very long, usually a couple of minutes, but if it comes to more sensitive skin, it could be 2-3 hours, which is rare, but it can happen. Okay, as I love combining different treatments, so we were performing treatment for the scars, but I like to top it up a little bit with mesotherapy. Mesotherapy, I'm going to use product Rose, AMIKO Rose, and again, I'm always thinking about the components in the product. AMIKO Rose contains 1.6% of the succinic acid. So the succinic acid, again, is going to help with angiogenesis, it's going to help with collagen production. Apart from succinic acid, there's many other components, exosomes. So it's going to speed up the healing of the skin. It's going to speed up the transformation process of the scars treatment. I'm also going to use Rose under eyes. There's a little bit of the dark circles visible under eyes. The dark circles under eyes, most of the time, I would say 99% are caused by problem with the vascular system. So the vessels might be too deep, the vessels permeability might be quite large, so they might be leaving deposits of iron. And again, succinic acid is going to deal with those problems. So we want to brighten this area, we want to get rid of the dark circles, and AMIKO Rose is going to be absolutely a phenomenal product for that. Under eyes, I am going to use not a lot, 0.33 maximum under each eye. I am going to disinfect the skin again. As you can see, I'm not using numbing cream, but I'm using nanosoft needles, virtually painless procedure. Can I ask you to open your eye, please? Very small deposits, just a couple of deposits. Deposits are going to stay in the skin for a couple of minutes. If the skin is very dehydrated, if the skin is quite damaged around the eyes, very thin, the deposits might stay up to 2 to 3 hours. That's it. So as you can see, very tiny papules, 0.33 maximum under eye. Is it painful for you, the injections? No. So we want to address the dark circles. We want to thicken the skin around the eyes. We want to address pigmentation. That's it. Brilliant. And I'm also going to use AMIKO Rose in the area where I was treating scars to support even further the process of angiogenesis, the process of the healing. So just little deposits. You can use this product with microneedling. Just where I was performing the treatment of the scars. succinic acid is a phenomenal product. It's very important what percentage is in the product containing succinic acid. Succinic acid receptors are not activated if there is less than 1.1% of the product, of the succinic acid in the product. In the rose, we have 1.6% of the succinic acid, so all the succinic acid receptors are activated. Succinic acid works in a fascinating way. It's a product, it's a component which is naturally occurring in our body, and when the body is under hypoxia, succinic acid receptors are activating, so all the nutrients are drawn to the place in order to revive the organ, revive the skin. Luckily for us, we have succinic acid receptors in the skin, so we can use this phenomenal product in the treatment of the scars, in the treatment of the pigmentation, of course, anti-aging. Very, very wide use of this substance, natural, phenomenal substance if it comes to redermalization. We have performed mesotherapy. Now we're going to apply Auric Day Cream. Why Auric Day Cream? I always pay attention of the professionals to the fact that when we are performing microneedling treatment, when we're performing mesotherapy treatment, we choose very carefully the components. We make sure that the products are sterile, that no chemicals are getting inside our body. And you need to remember that many chemicals, which are especially water soluble, will penetrate the barrier, the skin barrier, and will get inside the system. And in AMIKO, we have chosen, again, products such as succinic acid, such as mannitol, colostrum, which is over 100 ingredients. And for me, in colostrum, if it comes to post-treatment cream, the most important substances are lactoferrin, lactoperidase, which are the strongest natural antibacterial, antifungal components. So I'm causing occlusion on the skin. I know that when the client is going to leave the place, is going to leave the salon or the clinic, there won't be any infection due to penetration of the pathogens. So just one little pump on the skin, and I'm going to complete the treatment with the application of the SPF. AMIKO SPF also contains peptides, anti-inflammatory healing, just a little pump. SPF 50. And we're going to invite our wonderful client for another session in 2-3 weeks' time. In the case of my patient, we're going to invite her in 2 weeks' time. But remember, the more intense the treatment is, the longer the gap between the treatments. So if I was to do the whole area treatment of the scars, the next treatment would be in 3 weeks. Thank you very much.